A new report shows that opioid-related deaths more than doubled in Hamilton during the initial months of the pandemic compared to the 4 months before that. It's being called a parallel crisis. As lockdown restrictions took effect in the spring, more people were using drugs by themselves. Kelly Botello has details.
It highlights the tragedy.
Ontario's chief coroner, Dr. Dirk Heyer, says the opioid crisis is a tragedy. Overdose deaths were up 35% in the province at the start of the pandemic.
These are individuals. These are people who had families, friends, who lived their lives and were in communities.
Hamilton is one of the hardest hit cities in the province. From December of last year to mid-March, there were 18 opioid-related deaths in Hamilton. But from mid-March to the end of June of this year, when Ontario was in the most strict lockdown phase of the pandemic, 40 people died of opioid overdoses in the city, more than double.
First of all, because of the pandemic, we are hearing that people who use drugs tend to be more isolated. They're at home, so they're not necessarily with other people.
A report released today by the Ontario Drug Policy Research Network found that in 3 out of 4 opioid-related deaths during the pandemic in the province, no one was around to intervene. The provincial NDP critic for mental health and addiction says the Ford government hasn't done enough to address the crisis and says it's no coincidence that the cities with the highest opioid overdoses during the start of the pandemic were also the cities with the highest COVID-19 cases.
You know, it's a parallel crisis.
Michelle Baird with Hamilton Public Health says some drug samples collected in the city contain the extremely lethal carfentanil, but the majority of overdoses have been coming from a different mix.
The majority of substance is a fentanyl heroin mix.
The overdose rate in Halton stayed the same in the months before the pandemic and at the start, and the Niagara region saw a slight increase when lockdown restrictions began in mid-March. Hamilton Public Health says despite the troubling numbers in the city in the spring, we are on track to have about the same number of opioid overdose deaths as 2019. But every death, one too many. Kelly Botello, CHCH News.